Hi friends, this is Dr. Amber Lyda, and this is the YouTube series about how to manage trauma symptoms, and it's largely going to be focused on turning down symptoms. So if you're doing trauma work, a lot of times the work with your therapist will be learning to open things up. What kind of gets neglected sometimes is helping you know how to close those things back up after session. So what I noticed in years of doing trauma work is that to cope with it, to cope with horrible things that have happened, we have to do a lot of packing it away. And so it gets kind of smushed down or buried or put into compartments off to the side. And that's a functional, adaptive way to get through life without being completely overwhelmed all of the time by trauma symptoms. And some people who haven't been able to cope that way find themselves just chronically emotionally dysregulated. So feeling like they're raw all the time. I think a lot of people who describe themselves as empaths have this kind of sensation, like if you've been burned really badly, even air touching the skin can hurt. And the same thing, if you are so vulnerable to emotions, just walking around the world can hurt. So I want to pause here to say that the techniques that I'll be teaching, while they are geared towards survivors of trauma, if they work for you, that does not necessarily mean that you've had trauma. So some of us are just born with some hypersensitivities, and some of us come to those through experiences in life. So while I am creating this for survivors of trauma, if you happen to be somebody who is highly empathic or highly sensitive for reasons other than that, you might find these videos helpful as well. So we'll begin shortly, and I hope that you find them useful. If there are some other things that might be useful to you, please let me know. You can do that in the comments below if you'd like, but it might be more private for you if you do that privately. I have email that you can get in touch, and I'll link all of those things below. What I would encourage you to consider is that sometimes through experiences in life, we lose our filter and we share things that perhaps are better kept to ourselves or with people who have really earned our trust. So social media and YouTube and commenting down below, those are some of the places that I would encourage you to keep your private things private to you and those of you, those in your life who you have learned to trust through experience. The other thing is I can't protect you. So if there are things that you're sharing online and then people come in who are insensitive and say hurtful things, I might not be able to catch it before it injures you. So please be thoughtful about what you share to protect yourself. And if you're reading comments and you're somebody who might want to lash out, I would ask you to also please be thoughtful about protecting people who are vulnerable to pain like that. The other thing that I want to add here with this series is that it's very helpful for you to be in therapy, and this is not a substitute for therapy. This is just some skills training that you might find useful as an adjunct to your personal work or to your therapeutic work. If you are in therapy and you want to use these videos, please talk to your therapist first. They probably have a very good idea about your treatment plan and what would be helpful and what might not be helpful. And it could be that these videos aren't a good fit for you at this time. They might want to slip it into pacing sometime earlier or later in your treatment. So just be collaborative with the people that you're working with and make sure that you're on the same team moving towards the same goals. And the last little thing I'm going to add here is that this is not a place for crisis management. So I have pretty good work-life balance these days, and I do not check my social media frequently, and this isn't a good place to get emergency services anyway, even if I did. So I will put some numbers below that are great places to get immediate support if you need it. And when you're not sure what to do, you can always just call your local emergency room and you can get support right away. If you're feeling like you're in crisis or emergency, please get to somebody who can respond to that quickly, and I'll share some links below about that. Okay, here we go.